Hello, and welcome to a review of your musculoskeletal subsection. Your musculoskeletal subsection is arranged according to body area, top to bottom, head to toes. This includes your procedures on bones, cartilage, joints, ligaments, muscles, and tendons. First, you need to locate in your op note what body area the procedure is being performed on. After you figure out which body area the procedure is being performed on, you want to figure out what was done. Under each body area, you will find some subheadings. You can have one or more. It can read incisions, excisions, introduction or removal, repair, revision, reconstruction, fractures, dislocation, manipulation, arthrodesis, amputations, and any other procedures that may not be listed above. Let's review the types of fractures. First, you can have a closed fracture, which does not break the skin. You can have a dislocation, luxation, or subluxation, and all of those terms are interchangeable. The definition is the injury to a joint, abnormal separation of a joint, or a significant structural displacement, meaning usually of a joint. You can also have an open fracture, which would break the skin, and that's also called a compound fracture. There are different types of fracture treatments. A closed fracture treatment can be manipulation or reduction of a fracture. That's just making sure that the bone is pushed or pulled back into alignment. Can be without manipulation, just simply stabilization or immobilizing a joint, or not a joint, a fracture, or simply by putting it in a cast or a splint, meaning it's not out of alignment in the first place. And it can be with or without skeletal fixation. The definitions of skeletal fixation: you can have external fixation, which is done percutaneously with external fixators like pins or wires, and it's done to stabilize a fracture so it doesn't move. External fixators are usually removed as soon as the fracture is healed. You can also have internal fixation, and this is done by surgically opening to the fracture site, followed by insertion of a plate, pin, or rod. Plates, pins, and rods can either be left in, and sometimes if it's bothering the patient, they can be removed. This is also referred to as ORIF, which stands for Open Reduction Internal Fixation. Something that's important to know is that the type of your fracture treatment does not usually or always correlate or dictate what kind of a fracture it is. So it can be an open fracture with a closed treatment, or a closed fracture with an open treatment. Another thing you need to know is that all fracture care in this section is subject to a global surgical package. Earlier in your introduction to your CPT guidelines, you were taught about CPT surgical package definitions. Well, the global fracture care falls underneath the CPT surgical package definitions. Your global fracture care includes fracture treatment, whether it's open or closed, pinning, application and removal of initial cast or splint, routine uncomplicated follow-up care. The usual global fracture care is for 90 days. You can refer to page 505 in your textbook for the CPT surgical package definition. Other procedures that fall underneath this section are arthroscopy, which is viewing of a joint through a scope, arthrodesis, fusion or surgical fixation of spine or a joint, and arthroplasty, which is surgical repair of a joint or the fashioning of a movable joint. I'm sure you've heard about people that have had total knee replacements. Well, that would be referred to as a total knee arthroplasty. This is just keeping it simple and giving you some of the basics of the musculoskeletal subsection. Happy coding!